Hello, and welcome back to my channel, Cypress Wellness Collective. My name's Erica Bent. I'm a licensed therapist and eating disorder specialist. I'm certified in a therapy called family-based treatment, or FBT. FBT is a frontline intervention for adolescents and children going through eating disorder recovery. And it really focuses on empowering the parents or caregivers to support their child's recovery. In today's video, I'm just going to talk about phase 1 of FBT. We'll go through an overview of what it is, what are the treatment goals, and what are some of the reasons why the interventions are set up the way that they are. And I'll provide you some tips and tricks to get through FBT. So without further ado, let's dive in. So phase 1 of FBT focuses on renourishment or refeeding. And what this means is just what it sounds like, how to help your child learn to eat again and not engage in eating disorder behaviors. It's also going to focus on the importance of medical stability because we can't really expect psychological recovery to happen if someone is medically unstable or has an undernourished brain. And importantly, medical complications can be serious, they can be fatal. Eating disorders have the highest mortality rate in all mental illnesses. And so we want to tackle those medical complications first so that the teen or child is safe. Parents are in charge at this phase of recovery, and we'll talk a little bit more about why that is later. And we want the teen to just focus on getting through the next meal or tolerating distress. It's one of the hardest phases in eating disorder recovery. They have a lot on their plate, so we want to make it a little easier for them. And it's going to be pretty hard for them. There's going to be a lot of distress. And so the more we can offload, so to speak, the easier it might become. So we focus on renourishment. Now, as I mentioned, the first goal of phase 1 of eating disorder recovery is medical stability. Medical complications can be quite serious and they can be fatal. And so we want to make sure that your teen is safe, right? And we also can't expect psychological recovery to happen in an undernourished brain. And in fact, the more that a teen has an undernourished brain, the more that they're experiencing malnutrition, often the louder the eating disorder becomes. And so it's much more difficult to treat someone when they are malnourished. And we're going to focus on getting them nourished first so that they have a chance of psychological recovery. A lot of times this can feel counterintuitive. Many people assume that we need to understand the root cause of an illness to treat it, or that their teen needs to be motivated for recovery in order to participate and collaborate in treatment and get better. And what we find is actually the opposite in many eating disorders, that we can't expect them to feel motivated to get better first. We need to help change behaviors first so that they can be nourished and be medically stable and have a working, functioning brain in order for them to develop that motivation for recovery. An important caveat here is that undernourishment doesn't just apply to someone who's in a low weight body. That is definitely true for someone in a low weight body, but we can also think of nourishment as perhaps someone is in a quote unquote healthy range for their body, but they maybe focus on clean eating. They may be avoiding fats in their food or carbohydrates. And this can also lead to an undernourished brain. So you want to think about nourishment in a global sense and make sure that you're not just thinking about weight. Okay, so parents are in charge of refeeding. This is a big task, and it's often a really stressful task. But what does this mean? It means that parents are planning all of the meals and snacks. They're doing all of the grocery shopping. They're preparing all of the meals. It is a cumbersome task. And any way that you can make this easier, by all means do. So batch cook your meals, get a lot of support. If you have friends or neighbors or whoever, if you have a partner and you can share this task, do so. If you can afford a meal service, do so. It's a lot of food, and it's an arduous task, right? You've probably prepared meals for your entire family for a long time, but when you have someone with an eating disorder, oftentimes if they're in this phase one, they need a lot of food, and more food than you would anticipate needing. And so it's a lot of work. So that's first and foremost, parents are in charge of all of that. And parents need to be supporting the meals and snacks. So plan on having every meal and snack with your child and sitting for 30 minutes for meals and about 15 minutes for snacks. And I always recommend having some structure to it. And so after that phase of, let's say, 30 minutes, if your child hasn't gotten through the full meal, then you're going to offer some kind of replacement for another 10 minutes or so. And that, by replacement, I mean a Ensure Plus or a Boost Plus or Kate Farms or Lutrish, some kind of liquid supplement, or it could be a Cliff Bar, anything that you're offering in replacement of the meal. Because importantly, whatever the meal is their meal plan and is their medicine. They need to be able to get through all of it to have a full recovery. And if they're not able to get through all of it, that's okay. Some meals are going to be really hard and they're not going to be successful and 100% completion all of the time. But you want to enforce that structure and send the message that the meal plan is their medicine and you're going to fight for their recovery and they need to try to get it in another way. So there's a second option. Now, you want to have consistency, you want to have structure, and ideally you want to be supporting meals and snacks in your home environment where it's safe and it's consistent in these early phases of recovery. There's nothing more important than getting through these meals and snacks. Now, your child should not have any input in food-related activities or choice at this time. Until they are healthier and have a stronger, healthy self, or healthy brain, so to speak, then they are off the hook with some of these decisions around food. Their main goal is just to focus on eating. And we often can't expect them to make healthy decisions around food. In this early phase of recovery, I want you to consider that the eating disorder is the one who is driving some decision making. And if the eating disorder is driving the decision making, then if we accommodate that decision, then we're inadvertently reinforcing that eating disorder brain. And recovery from it is going to be harder. So we don't want them making decisions at this time. Parents need to set up an environment where eating is not encouraged but expected. As I mentioned, we're going to aim for 100% completion. 100% really does mean everything on the plate needs to be consumed, down to that last crumb. Now, that might feel a little infantile, but in eating disorder recovery, it's essential because, again, if the eating disorder is driving any decision making, then by not enforcing the consistent structure and the expectation, we might be inadvertently reinforcing that eating disorder. So in this early phase, we want to provide a lot of structure, a lot of clear expectation, and that means 100%. So there's no room for the eating disorder to win. And definitely offer some kind of replacement. The replacement ideally is something that your teen can get down. So we recommend Boost Plus or Ensure Plus. Those are going to be kind of wholesome replacement options, and they're liquid, so they oftentimes are easier. Make sure that you're putting it in a glass or a mug, and not giving them something with the nutrition label on it. Parents are also in charge of interrupting any behaviors that may reinforce the eating disorder. This includes things like restricting, binging, purging, compulsive or excessive exercise, or diet pills or laxative use. Any eating disorder behavior, we want to interrupt that. So that might mean if your child is prone to purging, that after a meal or snack, that you're watching a television show together or you're playing a game. You're making sure that you're having some fun family time in that period of time where purging might happen. So it doesn't feel so punishing, like I have to supervise you, but it's more enjoyable, but it also is supportive. Like, this is the time where your teen is maybe in the most distress from eating disorder thoughts and urges. It is hard for them to tolerate that. So provide support, provide compassion, sit with them, offer a welcome distraction, make it engaging and supportive, but importantly, you're helping them not engage in those behaviors. It may also include mental preoccupations like body checking behaviors or calorie counting or negative social media use or self critical thoughts or isolation. These are eating disorder adjacent behaviors, but they're equally important to provide support. So talk to your teen, get a sense of what they're experiencing and how you can support them with some of these things. Now, you may be thinking, why are parents in charge of refeeding? Doesn't that infringe on my child's rights? In a way, yes. But it's also essential for their recovery. Because at this phase of recovery, most likely, they're not able to stop eating disorder behaviors or thoughts. And they may be so aligned with the eating disorder behaviors and thoughts that they don't even realize they're engaging in them, or they don't want to stop. So importantly, we have to understand the eating disorder brain or the undernourished brain. If your teen has an undernourished brain, then most likely one of the things that's happening is that their amygdala, which is the emotion center of the brain, is more in control. It's in the driver's seat of their thinking, of their behavior. And the prefrontal cortex, which is already underdeveloped in an adolescent, is offline, so to speak. They're oftentimes in an overactive fight or flight or freeze response. And so they're going to be emotionally reactive and they're not going to be as logical. And so we can't expect them to make decisions that are going to be healthy for them coming from this place. We also want to understand that many eating disorders are egosyntonic. Now, this means that the illness, the eating disorder, often aligns with the person's identity, values, they're enmeshed, so to speak. Think about it as though you have your teen and their brain is being eclipsed by the eating disorder. They've lost a sense of their identity, their values, their sense of self outside of the eating disorder. They've become aligned. And it often means that they're making decisions from this place, from the eating disorder place, but they don't have a desire to change, and they don't necessarily see that there's anything wrong with it. And we can also understand this in the stages of change and the path to recovery. So when we think about stages of change, the first stage of change is often denial, or what we call pre-contemplation. There isn't an awareness that there's a problem. And even if there is an awareness that there's a problem, there's not a desire to change. For teens, often this is an experience like, my parents are telling me there's something wrong, but they just don't understand me. Right? Or everyone is trying to take this thing away from me, but it's the only thing that makes me feel better. I'm angry, I'm upset, I'm going to push people away. Right? So there's a sense of denial, there's a sense of feeling misunderstood. There's no desire to change. And so parents do infringe on their teens' rights, but we have to understand that they're not in a place to be able to make healthy decisions. And what we find in eating disorder recovery is that we often need to make that behavior change first in order for this important psychological change to happen. Especially when they're in an undernourished brain. We can't expect that psychological recovery to happen if they're not physically well, right? And so we do see some of these shifts happen later on in recovery. Importantly, we want to find ways to respect your child's need for autonomy and agency, but this has to happen outside of anything related to food or health during this phase. So find ways to respect your teen's sense of autonomy outside of eating. Now, this might be they're not able to go to a friend's house for a sleepover because there's too much opportunity for the eating disorder to be engaged in, right? Breakfast over there, it wouldn't be supervised, or perhaps they may engage in excessive exercise. Whatever it is, they need to be under supervision. They need to be supported at this time. But you may be able to have friends over at your home for a sleepover. So find a way to create some sense of normalcy and support your teen's sense of autonomy, but not in a way where the eating disorder could get away with something. Be on the lookout for other shifts in mental health, like increased anxiety, panic, anger, depression. At this phase in recovery, this is common and these emotions are expected. When your teens begin recovery, they're often in a very early stage, as we just talked about, and maybe not aware of the problem or not interested in addressing the problem. The eating disorder is adaptive. There's a reason they have it. It's helping them with something, and it's often helping them with something that they may experience as deeply painful or incredibly overwhelming. So when we stop the behaviors in the early phase of recovery, we see a huge increase in distress. This is normal. This is expected. But we have to tolerate that distress and not engage in the eating disorder behavior as a way to decrease or eliminate that distress, because that will just reinforce the eating disorder as the solution and further cement it in your child's brain. So importantly, we have to tolerate the distress that comes with it and still move forward with recovery. So I always tell parents, don't look at psychological aspects or symptoms as a sign of recovery in this early stage. Focus on behavior shifts. Is your child eating? Have they decreased exercise? Have they decreased a sense of purging? Those are all good signs that you're moving forward in recovery, even if you're noticing they seem more depressed or more anxious or whatever it is. Importantly, you want to make sure they're safe. So if they're developing signs of self-harm or suicidality, talk to your team about it. Make sure that they're safe, because that is also common in this phase. And we don't want to reinforce the eating disorder, but we also have to ensure safety. Distress is expected, and the more consistent you can be with treatment recommendations, the quicker distress will decrease. So if your teen is experiencing a lot of distress around their eating disorder, but then you negotiate or accommodate an eating disorder request or symptom, then as a way to eliminate distress, then it thwarts our efforts in recovery. And it further cements that eating disorder as the solution. So we have to find ways to tolerate distress and not give in to the eating disorder along the way. Tune in for a later presentation where we'll talk specifically about how to cope with distress. And when the goals of phase 1 are complete, you move on to phase 2. And in our next presentation, we'll talk about when are you ready for phase 2. Be sure to talk with your treatment team, because they're going to know your family and the specific nuances of your teen's eating disorder. And that decision is an important collaboration between you and your treatment team. Thanks for joining today, and we look forward to connecting with you again in a later presentation. If you're interested in more resources, check out our website. We have some great articles to educate on family-based treatment and eating disorder recovery, and be sure to like and subscribe for more. Thanks so much, and see you next time.